So there are actually different types of patients you see in the radiology department. So you could see a patient that was just born and is still within 28 days of life. That's a neonate, that's a newborn. You can see pediatric patients, which is basically a child. You can see adolescents, which is basically, I think, from age 9 to age 17. Then you can see an old patient. I didn't actually mention adults because adults are like the most common patients you see in radiography departments, okay? So these other ones are scarce, okay? So, or will I say they are special? So that's why we're actually discussing them. So there are some things that you should actually put in mind when you are handling any patient that falls within these categories. So neonate patients, this is a patient that is actually between the first 28 days of life. So they are very sensitive to radiation. So you have to make sure that the radiation energy that this patient is being exposed to is as little as possible. Do you understand? So they have a fragile physiology. So when you are handling them, turning them, you have to be very careful. So immobilization, you have to keep them in a very good position so that the part of the body that you want to image is not being moved, so that you have a very nice image once and for all. This will actually reduce the incidence of you exposing the child to the x-ray again. So common examinations for neonates include chest x-rays, mostly for respiratory issues. Then sometimes you are trying to survey the skeleton to see if there's any skeletal issues, skeletal abnormality. So pediatric patient now, it's a child that is between 1 month of life to 12 years. Okay, some people say 9 years. So the body size is still small, so you have to still adjust the exposure. Sometimes they are afraid, so they move. So you have to actually talk to them, use immobilization devices, assure them that there's no problem. So the environment should be child friendly. Okay, you have to protect their thyroid gland from exposure to radiation. You have to protect their reproductive organs from exposure. So adolescent patient, this is somebody that is between age 13 to 18. So they are now going closer to adults, but their psychology is still different, So they always like privacy. This is when they are now getting to know more about themselves. They are trying getting to see their genitals, So you don't really expose them anyhow. You respect them, So they usually cooperate if the instructions are clear. You have to explain yourself. So radiation dose is still a concern, and you have to adjust the radiation just to what is needed, So geriatric patients are people that are between age 65 plus. So now the metabolisms of the body is actually tilting down. Soft bones, soft this, soft that. So you have to be careful. So positioning may be require cushion, so you have to be careful. Communications must be clear and make sure that they have understood. So those are the criteria, or what I say, considerations you look at if you are dealing with a patient that falls under any of these categories.